Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Hello, everyone. Welcome to another edition of the Empowering Plans Podcast. I'm your co-host today, Brady, Bizarro, attorney with the FIA Group, as you know. And joining me today is our Vice President of Consulting, Kelly Dempsey. Say hello, Kelly.
Hello, Kelly. Don't tell Adam on me that I said that, okay? Thanks.
I won't, but I'm sure he'll be happy that you followed the rules. So today, we've got a lot to talk about. We're in the dog days of summer. I think that's what we can call it. And we just had our webinar and talking about all what's going on in the world of healthcare with vaccines, with boosters and full approval, all kind of things happening as we enter the fall. And hopefully we're not regressing in the world of COVID. But nonetheless, we do want to give you guys some important updates in today's podcast. Some things that we touched on in the webinar. What are the implications of what's changed in terms of the full approval for vaccines? We're getting a lot of questions about people who want to impose what's being called these vaccine penalties or unvaccinated penalties for people who are not getting vaccinated. And so we want to break down a few of those things for you today. And as always, if you have questions and you want more detail, you can feel free to reach out to us at pgcreferral@fiagroup.com. But for now, let's get started and talk about what's gone on lately. As most of you know, if you haven't lived under a rock, a couple of days ago, I believe it was on August 23rd, the FDA came out and granted full approval for the Pfizer vaccine, something that's been really in the pipeline for months now. We've been waiting for it with bated breath. And now that we have full approval, the hope out there in the communities is that more people will actually get the vaccine. But we want to focus on what does this mean for health plans, if anything, for employers, and what do you need to know now that we have full approval? Well, the first thing to know is that this full approval was granted for those ages 16 and above. So there's still some people, children, 12 to 15, for which this vaccine continues to be an emergency use authorization. So that's a slight distinction there to keep in mind when we talk about the vaccine being approved. It's just there's still a category of people for whom it is not fully approved. But what does this mean? Well, first of all, you're now going to see the vaccine marketed on TV under a brand name, Comirnaty. I believe that's how you pronounce it. Don't hold me to that. You can check it out for yourself, but that's going to be the brand name of the Pfizer vaccine when it appears on TV. The other thing to note is that because it's now fully approved, it can now be approved for off-label use, which we may see some of that happening. So essentially, any vaccine or any other medication that's fully FDA approved can be prescribed for an off-label use by a physician. Of course, there's some risk in doing that. We don't expect to see a lot of that from doctors in the case of this vaccine, because it's still being tested for children. But there have been cases of the elderly getting a booster shot, even though that's not been approved by the FDA yet, under this sort of off-label use rationale. So you could see more of that. And then finally, and probably most importantly for our listeners and our clients, is this will lead to more vaccine mandates. We've talked about in the past, and there's been guidance released by the EEOC and other agencies indicating that vaccine mandates are largely enforceable. This, I think, is the final nail in the coffin on that end, because most of the cases, including one from 1905 in Massachusetts, which forms the basis for these vaccine mandates being constitutional, involved drugs that were fully FDA approved. Or if there wasn't that kind of a process back then, the thinking in terms of the legal guidance is that you need to have a drug that is fully FDA approved to really compare today's case with cases of the past. And now that you have the Pfizer vaccine fully FDA approved, it sort of removes the argument that I saw in many of the cases in Texas and Indiana and other states in which the plaintiffs were saying, well, this is an experimental drug. We're challenging this mandate on that basis. So since they no longer have that basis, I think we're going to see a lot more entities, private and public, and we're seeing that already with the military and certain police forces around the country, making this vaccine mandated. And so if you have questions about whether you can do that or how you should do that, reach out to us and we'll let you know some additional guidance there and provide our thoughts. Okay, on to the next big topic. And this one is actually going to have some implications for plans. And so, Kelly, get ready for this one. But we've also heard about booster shots, right? I think a little before the full approval came out, there was a note from the president. He came out and spoke about how he wants Americans 8 months after their second shot, if they're getting the mRNA shot, to get a booster. And probably we'll see this go first to nursing home residents and healthcare workers like we did last time. But eventually he wants all people who got the shot 8 months after to get this booster shot. And so as we know, this could have or will have a pretty big impact on plans who may have to pay or probably will have to pay for some of these booster shots. So Kelly, what are the rules there? What are we seeing? What are we thinking about whether plans will have to cover booster shots?
Yeah, so that's a great question. And we have definitely already started getting that. And, the answer is probably eventually. Right now, unfortunately, this issue is obviously unresolved because there hasn't been any sort of formal guidance or approval by the CDC. So, we're still waiting. But our inclination, and I think Brady, you would probably agree, that the thought is that if this is something that goes through and eventually gets the CDC, guidance, it will likely happen and plans will likely have to cover it. And, there's definitely been a lot of talk in, on the news and in other various areas about whether the COVID and the way that it morphs as a virus is similar to the flu shot and the fact that, we get a flu shot every year based on whatever certain strains are flagged to be prominent in that year. So there's the possibility that COVID, because once a virus is here, they progress and advance very quickly. And that's why viruses exist, because they morph very quickly to stay alive. So it's possible that this booster situation, it might become annual. It's all speculation. We don't know. But from a plan consideration, likely plans will probably have to cover this at some point in time. We would expect more guidance and direction on this when the booster program officially and formally launches. And the CDC has already recommended boosters for certain immunocompromised individuals. So individuals that are getting cancer treatments and other specific types of immunodeficiency diseases. I looked at the CDC page myself the other day when somebody outside of work asked me a question, just because I was curious as to what they were classifying as immunocompromised at this point in time. Because that word can mean a lot of things. So for right now, there were definitely very specific diseases that were listed and conditions, and it's not necessarily what you might consider as immunocompromised, like somebody that has a heart defect could be immunocompromised. They're not on that list yet. But again, speculation. Brady always likes to look in his crystal ball. So I would guess by looking in mine that it's probably on the horizon. So be prepared. That is definitely probably the next thing that plans will have to do. That's where we are with that right now. So I think probably the next hot topic, and Brady kind of touched on it, is the concept of a surcharge for individuals who refuse to get the vaccine if an employer either mandates it or requires it. But from a plan perspective, if somebody wants to mandate a vaccine and they refuse, can a plan, Brady, increase the charge or the surcharge for their participants if they refuse to get that vaccine?
Yeah, it's a great question. And like a lot of legal questions, the answer is it depends. And I'll give a more solid answer in a second, but I just want to back up for a second and just sort of note the background here. This has really come up. I've seen this in the news a lot in the last few months, but only just a couple of weeks and even a couple of days ago with certain companies announcing that they will be utilizing these sort of surcharges. Delta Airlines, the most recent one earlier this week. Remember, the thinking is that, look, if we're already paying, we as a health plan, a lot of money for people who are getting treated with COVID, we know the hospitalizations are very, very expensive. I was reading an article before about how unvaccinated people are costing health plans a ton of money. The thinking is, right, the natural thinking is to say, how can we curb this cost for a health plan? How do we incentivize our employees to get the vaccine so that if they do get sick, they're not ending up hospitalized and costing the plan a lot of money? So you can see where this is coming from and why it makes a lot of sense. I saw a lot of polls, even on LinkedIn, from people in the industry saying, what do you think? Should employers do this? And many people were saying yes, way more than half. And so what we've seen, Delta as an example here, I think will provide some good guidance to answer the question. They're charging an extra $200 per month per employee for health insurance. So that's a significant amount more. I mean, think of the course of over a year, right? That's something like $1,400 or more than that, over $2,000. My math's wrong there. Don't tell Jen. But that's a lot more money, right? As in a surcharge. Every month you're paying $200 more for your health insurance. The question is, can you do that? Is that allowed? What are the rules surrounding it? The thing to know is that typically, right, the rules that apply in this context, the Americans with Disabilities Act, HIPAA, because the issue here is, are you treating someone differently, discriminating, in other words, against them based on a health factor? And if you are, it's not allowed. And so it's the reason why you can't charge people more who have cancer or AIDS, or in this case, COVID-19. And so you would think that it's a flat no, the answer, right? But it's not. And the reason it's not is because wellness program rules can actually provide the context and the sort of vehicle for which employers can assess this surcharge if it's done correctly. So as some of you may remember, there are certain guidelines and requirements and rules related to wellness programs. You can charge fees to employees as long as they're not coercive. That's from the EEOC. And the rewards and penalties in these programs can't exceed 30% of the cost of employee-only coverage, which last year was about $7,400. That's from Kaiser. So if you look at Delta's example, right, the $200 a month penalty or $2,400 a year is more than 30% of the average cost for employee-only coverage. So technically, you might see this all over the news. Delta is doing this, but it's not allowed. I think it'll be challenged pretty easily in the courts and be found to say this is coercive. This is too high of a fee, which begs the question, what is a reasonable fee, right? If we know 30% is sort of the EEOC's guidelines, I think you'll see some employers try and implement a lesser fee that's under the 30% of employee-only coverage. So the short answer, I said it depends earlier on, but it's really a yes if, right? If you're structuring the fee within the context of a wellness program, and you got to be very careful how you do that, I think this is allowed. I think unless a court weighs in some other way, but the Delta plan is not one to follow because of how extensive and burdensome the fee is. But I think there's a way you can structure this to be permissible. So I don't know if you had anything to add there, Kelly, or what you thought about Delta's program.
Yeah, I totally agree with you. And I didn't want to do the math because I hate percentages and fractions and all that fun stuff. But I agree with you that the amount, when I read that, when I first saw the headlines and saw the amount, I was like, I wonder from a penalty perspective, how much that is compared to things. And obviously this news has continued to develop this week. So I agree with you. I think that the amount of that penalty is what's likely to be challenged first and foremost. And, right now, unfortunately, a couple years later, we're still waiting on actually the end results of what type of incentive or penalty is considered to make a wellness program still voluntary. If you remember, we've been talking about this for a while, and the EEOC had a lawsuit against the AARP, and they came back and they said 30% is too much, but they haven't really issued any guidance on what isn't too much. So, reports have said maybe 20% is a little bit viewed as more voluntary and not coercive. We still don't know what that percentage really is at the end of the day. So we're still waiting on that because rules were issued at the beginning of this year, but eventually retracted with the change in administration. So we're still kind of in a waiting in the wings situation with wellness programs, and this whole situation with, the incentives related to the COVID vaccine has obviously pushed it probably back to the forefront of discussion. So it's fun how that one keeps ping-ponging around. But I agree with you. And I think the other comment that I would have here, because I don't think anybody's asked us this yet, but I would, speculate that maybe somebody's kicked this around in their mind about the concept of requiring a COVID vaccine in order to be on the health plan. That I don't necessarily think would be permissible because the EEOC has already previously issued guidance about barriers to entry into the program. And I don't see that would be permissible. Again, this is just me spitballing. I have not researched that, but based on, history and other cases that we've seen, I don't think that you could create this as a barrier to get on the health plan, but definitely you could incentivize individuals by adding a surcharge, some sort of other incentive to get the vaccine. So it'll be interesting to see how this one develops. And, I think that we will obviously be hearing more.
Yeah. And I think the bottom line is, and strangely, from a legal perspective, I think employers are probably safer mandating the vaccine than they are trying to work in some kind of penalty because, as I said, it's sort of firmly established in the law. And now that you have a vaccine that's fully FDA approved, clearly the reason this is coming up is that employers are finding that the carrots aren't working, right, for many of their employees. They're not getting the vax. And they want them to. So they're opting for the stick method. But it just seems, legally speaking, that the clearer way forward at the moment seems to be with a mandate, although that's, the public relations aspect of that might be a reason why, employers are trying to use the stick method instead. But we'll see where things go from there. One other topic I want to just finish on, Kelly, while we have a few minutes left, it's a related question, I think a much more clear answer. And people have asked us this a lot about, can I exclude COVID-related claims for someone who's not vaccinated? So someone's not vaccinated, they get very ill, they're in the hospital, end up with an $80,000 or $90,000 bill, maybe even more. We've seen some that are higher. They're asking, can we deny all the person's claims? There, I think the answer is pretty clearly no, because you would be in that case discriminating against someone based on a health factor, and there is no loophole or saving sort of grace with a wellness program, right? The wellness programs exist in certain contexts as it relates to charging premiums, But here you're talking about excluding treatment. And I think it's pretty clear that a health plan would not be able to engage in that kind of practice without violating HIPAA and, the ADA potentially as well. So I think that one I feel more solid about. I'm not sure how you feel on that one, Kelly, but to me, it looks clear.
No, I definitely agree with you. I'm not objecting at all to anything you said. I think that excluding claims because somebody is not vaccinated is not going to be a good idea for anybody. And I think overall in this concept of, policies and procedures and all this stuff when it comes to COVID, I think employers really have to make sure that they're looking at employment policies versus plan rules and requirements. There's definitely a lot of blurry lines when it comes to these things. And there's a lot of, business decisions. Obviously, when you make a business decision, you want to color within the lines of any sort of compliance rules and regulations. But to a certain extent, yes, the employer is also the plan sponsor. So they can be viewed as one and the same entity, but everybody needs to remember to take that viewpoint and kind of separate the two issues from time to time where it's necessary to look at their requirements from an employer policy perspective versus a plan and what the plan's going to do. And then obviously make sure that they reconcile with each other and work together overall. But I do think that that's a crucial part to all of this is considerations from a business perspective as well as from a plan perspective, making sure that you look at them in the light that they need to and take in the relevant considerations and facts on each of those situations. Because it's an emotional topic, whether we like it or not. It's an emotional topic. There's a lot of strong feelings. So it's definitely sensitive. And the discussion surrounding all of these topics we've touched on today about the boosters and vaccines for children and charging unvaccinated employees higher premiums, these are all emotionally charged. So it's very crucial to look at it and make careful decisions when moving forward, especially as the regulatory landscape is going to continue shifting.
Yep. And they're also expensive topics, right? I mean, that's why we're seeing plans and employers take these actions. It's expensive enough to maintain compliance with all these changing laws and rules. But now employers are looking for ways to lower costs. And the reality is, like it or not, it's more expensive for unvaccinated people who end up in the hospital. And I think that's why we're seeing these questions. And we'll see more of them, but know that we have plenty of services to help you navigate the compliance rules. If you do get a large claim, we have claim negotiation services, as many of you know, to help potentially negotiate those in-network claims or out-of-network claims to a more reasonable amount for the plan. And so get in touch with us if you do have those questions. But for now, I think we covered a lot of ground. We certainly have more podcasts to come, more webinars to come, where we will keep these topics and others at the forefront, and we'll let you know of developments as they come along. So on behalf of myself and Kelly Dempsey and our producer, Pat the Man Santos, thanks for tuning in to another edition of Empowering Plans, and we'll see you next time.